Hi, my name's Brent Collier. I'm an accredited exercise physiologist and director of peak health and short circuit cancer. I've been in private practice for over 20 years and throughout that time I've seen a really big shift in the awareness of exercise and its use in cancer. Today I'll be presenting the COSA, or the Clinical Oncology Society of Australia's position statement, which is a very, very important document that has really increased the awareness of what we do in cancer treatment. We'll be discussing the exercise and cancer guidelines, the role of exercise in cancer care, and I'd like to spend a fair bit of the time talking about the big shift or the catalyst in what I've seen change over the 20 years in practice. And then Robin will present about exercise in practice and show how how she is able to connect with these patients and make significant inroads into their treatment. Firstly, I'd really like to thank all the researchers behind that put this document together. If you haven't seen it yet, there's a link on the bottom of the screen there. I sort of urge you to have a look at it and sort of know it inside and out. I'll go for a brief summary of it today. I actually use this every day with new patients. When they come in, they're quite often not aware of why they're always coming in to see us. Might have been their GP or their oncologist or a nurse saying you need to go off and see someone for some prescribed exercise therapy. And I find it really, really important that they understand that they're in control of this part of the cancer journey. So if it wasn't for those researchers, Prue Cormie and the rest of the team that put this together, I think we'd still be seeing people just as when they've finished their treatment, not all the way through. So COSA calls for exercise to be embedded as part of standard practice in cancer care and to be viewed as an adjunct therapy that helps counteract the adverse effects of cancer and its treatment. All members of the multidisciplinary team should be involved in promoting physical activity guidelines and recommend people adhere to them. Best practice cancer care is to include referral to an accredited exercise physiologist and or physiotherapist with experience in cancer. The guidelines themselves say that all people with cancer should avoid inactivity and return to normal daily activity as soon as possible following diagnosis and be as physically active as current abilities and conditions allow. The guidelines are made up of trying to get patients to build towards 150 minutes of moderate intensity exercise or 75 minutes of vigorous aerobic exercise, such as walking, jogging, swimming. It's very important to note that this doesn't all have to be done in one big chunk as well. So I'll quite often say to people that 30 minutes, 5 out of 7 days, and that can be broken up into 10 minutes here and 10 minutes there to make it a little bit less daunting for them. And the other part of it is 2 to 3 resistance exercise sessions per week involving moderate to vigorous intensity exercise, targeting the major muscle groups. The guidelines go on to highlight exercise should be tailored and targeted towards the individual's needs and abilities. So a little bit later when we talk about some of the advice around exercise is that the general exercise is great, but it does need to be quite targeted, particularly for bone health and loss of skeletal muscle mass during treatment. It should be prescribed like medicine, and that's why it's important that they see an accredited exercise physiologist or physiotherapist that has got experience in cancer care. Clinical research has shown, and this is very important, that exercise is a safe and effective intervention to counteract many adverse effects of the physical and psychological effects of cancer treatment. been shown to improve physical function, reduce cancer-related fatigue. Decreased stress is a very big, important part of it, and improve their quality of life. And of course, reducing the risk of other cancers and comorbidities. What the document also highlights is that it's actually not enough that we know all this. And again, Robin will go into that a little bit more in her presentation. Despite this advice, Australians with cancer, 60 to 70% do not meet the aerobic guidelines. 80 to 90% do not meet the resistance guidelines. So although people with cancer express a desire to become and stay sufficiently active, they need advice and support to do so. So again, highlighting the importance of the role of all members of the cancer care team, from the oncologists to the doctors, GPs, nurses, everybody should be referring directly to an exercise physiologist or physiotherapist with a focus on transitioning them into ongoing self-management. This where I'd sort of like to talk about where I see personally this big shift. So once the statement came out that exercise is not just making people feel better, it's actually having an act on the cancer cells themselves, was the airing of the Catalyst program on the ABC on the 10th of May 2016. And I still remember it because it wasn't long after that show that I was contacted by a group of oncologists at a major cancer centre that we'd been talking to for many years about the role of exercise, but they sort of saw us as the post-rehab. So we saw patients 2 to 5 years after treatment. And it was that show that sort of highlighted this big shift. And I remember saying to one doctor, Dr. Harris, and I said to her, why was I asked to come and present today? And she said, because patients are demanding it. And that was a really big step forward in our industry, that patients had seen this program, and some of the quotes from Professor Robert Newton regarding every patient deserves this treatment. So that was a really big step, with patients coming to their oncologist saying, I want this treatment. I don't want just the chemo. I actually want to go off and get this exercise medicine. So that was a really, really big day for the cancer treatment. So, and it showed the importance of that pre, during and post-treatment continuum of cancer. So if you haven't actually seen the program, again, from an education point of view, a patient will come in and see me on session 1, and we'll go over the guidelines and talk about their health history and take a thorough assessment. Quite often, as part of their initial sort of homework, I will send them home with a link to watch that program. I've got it embedded in my webpage, so it's easy for them to find it, because I find the more that a patient is engaged and more they know about what they can do, that we get a better result. So again, oncologists were asking, why are we waiting till the end of treatment when our patients are so deconditioned to actually start them on their rehabilitation? And wouldn't it make more sense that we do it during treatment to prevent the loss or deconditioning? That growing evidence out there that exercise is beneficial, not just to feel better, but is actually improving the outcomes of cancer patients. And that exercise can actually be done on chemo day, either before or after, was a big revelation to a lot of the people that we see. The groups they talked about in that program were exercising on chemo day and then going and doing gym sessions 3 days per week. And again, patients got to see that interview, and it's coming from other cancer patients, not just being told by health professionals. Patients quite often described that they had to drag themselves into those exercise sessions, but after they were there and when they completed the program, they felt they were they felt much better. They had less fatigue, they had more energy, their quality of life improved. More importantly, for their cancer, the oncologists were finding improved blood cell counts, improve patients' feeling, and the ability to take more of the treatment or get that close to that 100% of what they're trying to dose for the patient. Reduced fatigue and nausea were a big one, so people could actually complete their treatment. DEXA scans and again now the use of COSA scans showing that that average skeletal muscle mass of cancer patients can be up to 10 to 15%. But those in the exercise studies showed that they either blocked that loss and some in fact actually put on and gained muscle mass during the clinical trial. We quite often hear patients feel that they're out of control. Their doctors are the ones that are administering the cancer treatment, and they don't have a big role in that. But they can take that active role and use exercise as medicine, and it's again so empowering for the patient that they can be part of the treatment, not just be receiving treatment. So how does it work? One way I like to explain, and it's simple, and again on that program, it spells it out for people that are watching it quite clearly, that just one effect of exercise is increasing blood flow. So if they're to have an exercise session on chemo day, in particular, or days, that blood flow is being delivered right to where the tumour cell is, and what is carried in the blood is the chemo. But more importantly was what they've actually found, that it's actually exercise is helping your own body's immune system and an increase in natural killer cells that actually recognise the cancer cells and attack it. So the blood is sort of taken to that area, and your own body is basically using its own chemotherapy. Study in 2013, which was highlighted again in the program, was a Swedish study where they had 10 healthy individuals exercise on a bike for 60 minutes. Blood was taken before and after their exercise session. And what was really eye-opening was when the serum from the post-exercise group that was poured over the cancer cells. It was remarkable. It showed a 30% suppression of the growth of those tumours. Again, in 2016, exercise had been shown to reduce tumour growth by 16%. And again, inside those tumour cells, there was an increased level of natural killer cells, basically upregulating your body's own immune system, and then the body can start to produce its own chemotherapy. Bone loss is a big issue, as well as muscle mass loss in cancer patients. And again, this highlights the importance of a targeted approach rather than just saying that general exercise will make you better. One study showed that the use of the guidelines, so doing the aerobic exercise and the resistance training and normal exercise, didn't actually help prevent bone loss. It was the targeted approach, so resistance training combined with impact training, jumping, and again, it was a bit scary when the researchers were putting this out there, because people had bone mets, or they had because of the potential loss of bone, they were worried that if we treat them aggressively and we get them to jump and skip, would it cause more harm? But again, the research showed that in fact they prevented the bone loss, and some of the patients in the study group actually increased bone density during the trial. So I've brought up a few times, probably sounding a little bit repetitive. It just really highlight the need that patients deserve this medicine, and that they need to be seeing the appropriate professionals, so EPs and physios that specialise in cancer, to make sure they're getting that targeted approach and moving away from that that vague reference that exercise is good for us and it needs to be a clinically targeted exercise prescription. Again, that growing number of research studies that are showing if people hit that certain level of exercise, and we need to work out what that level is for each individual and each type of treatment they're on, that they can actually, that physical activity, if they meet that number, they can actually more than double their chances of survival, which again, if you are giving that education to a patient, it sounds too good to be true. So having documents like the COSA statement and programs like Catalyst, where the research is spelled out in very user-friendly terminology, again, it empowers patients to say that they can take that active approach to their own treatment. Since we've had SOZO in the clinic, it's been amazing to show patients that those results, that they're maintaining their muscle mass even when they're going through treatment. And the extraordinary thing is that there's no pharmacological intervention that can stop people losing this muscle mass, but other than exercise. So it's free. They don't need to go to the chemist for it. They can do it themselves. They can do it at home. They can do it in the gym. They can go and see a professional to help them guide along the way. So, and that's remarkable that, you know, exercise is a drug, okay? And if it was a pill, we'd all be going and buying it, but we don't have to. We don't have to buy it. We can just get out there and take an active role in our own treatment. I'd just like to take a little bit of time to talk about two patients that I've treated over the years with basically the same or similar circumstances. But one was Kevin, and he was treated quite a while ago, and he was 5 years post, and he didn't get referred for cancer. He was referred for his bone health. His GP and sent him in and said, look, we've got to teach you to exercise. And he quoted to his GP and said, I'm scared to exercise. He was a printer and he was doing lots of heavy lifting, and he sort of stopped working because in his mind, having the weak bones and muscle meant that he was at risk, that he was going to fracture. He already had compression fractures in his thoracic spine. So his doctor said, no, let's go and find out about how to exercise and how to move. So once he got the confidence and he saw these programs and were able to show him, you know, some of the research, he went from that very fearful non-exerciser. His treatment got him down to 59 kilos, down from his pre-cancer, which was 80 kilos. And now he's back to training 4 times a week in the gym, and he reports that he's actually feeling stronger than ever. It's taken a while, but he's built himself back up to about 74 kilos now. And he said that it's strange. He said that the cancer was the best thing that ever happened to him, because he wasn't overly healthy before, but now he finds he's stronger than ever. So if we compare his journey of 5 years of being really scared to get out and move compared to Gary, who presented just before he started chemotherapy. He was advised to come in early. So he's been exercising all the way through, and he goes to the gym himself. He's not with me all the time. And he goes to the gym on the way to his chemo. And then on his off weeks, when he's not receiving any active treatment, he goes to the gym 4 days a week, and he's found it really empowering. He looks forward to coming in and jumping on the SOZO machine. So you can see that he's not losing muscle mass, and in fact, he's actually gained a little bit of muscle mass over the time. Lost a little bit of fat mass, which he's quite happy about. But he really looks forward to it. He's very anxious about his other scans. MRIs and things. He's always worried about what's the result going to be. But he really looks forward to coming into his gym session and getting monitored, because he feels that he's taking that active control. So I suppose that's sort of where my talk sort of ends. I've probably gone through that, just a rough overview of the guidelines, hopefully leaving a little bit more time at the end for questions and answers in that section. And I'll now hand over to Robin to talk about how she's able to integrate that exercise into practice. Thank you.